We have a very large pain service Baptist. We have about 8 doctors who do epidurals for cervical and lumbar pain. We also do some ENT. We do a large amount of the gynecology surgery here in Lynchburg, and we also have a gynecology oncologist or cancer specialist that comes from Roanoke once a week to operate with our doctors for uterine cancer cases.
That's wonderful.
We have a big eye service. We do a lot of cataracts. We have a retinal specialist that operates in our operating once a week. And we also have some glaucoma procedures that we do, and we have a new corneal specialist that's come to Lynchburg, and he'll be operating in our ORs too. So that's basically what we do.
It would really be overwhelming if all of these procedures were done in one operating room. I don't think you could probably get it all done in a day, but by doing it this way, you have the time to focus on those particular patients and those particular services to a greater degree than you would if you were doing everything at both hospitals. I'm going to stop here because these girls have brought some pictures, and Phil, if you'll start showing the pictures, they will narrate and tell you looking at this in this operating room.
This first picture that you're looking at, this is the Da Vinci robot, and this robot, we purchased this, it's been 1 year ago, and this is what we use with our prostatectomy. And the traditional surgery was an open procedure that would take hours, and it was an extended stay for the patient. And the Da Vinci robot has given us the ability with this state-of-the-art technology to be able to increase the length of stay for these patients, increase their recovery, and have much better outcomes and a shorter length of stay in the hospital for these patients. And it's really been beneficial to us here. This console that you're at is where the surgeon will sit and use those foot pedals down there at the bottom, and he will strap his fingers with Velcro into this Da Vinci robot there that you can't really see that well, and the senses the movement of his fingers and is able to manipulate the instruments, and it's very precise and it's very detailed, and he's able to procedure with a precision that he was not able to do with a traditional open procedure. There's another picture of the Da Vinci there, and that shows the arms. There's 4 arms on that Da Vinci that hold the instruments, and the instruments have a rotation much like your wrist, and they snap into those arms, and that other console is what controls the movement on this part of the Da Vinci. So it's a 2-piece Da Vinci robot.
Great.
This is one of our instruments that is used, a piece of equipment here. It's the Zeiss microscope, and that's used for various services, orthopedic, ENT, as well as neurosurgery. And it's just a very high-powered scope, so they can magnify the tissue and be able to operate with immense detail. This is the Brain Lab, and this is a very state-of-the-art piece as well that's used for various services, much like the microscope, ENT, orthopedics, and neurosurgery. And it's an image-guided system, and we use it in orthopedics. Some surgeons use it for total joint procedures, and it gives us the ability to be able to make really precise cuts, no more of that judging and just kind of using your measurements and your templates that you'd used before. This is more precise and gives you exact cuts and better outcomes as well.
We use that piece of equipment also at the Baptist for sinus surgery, which is really a pretty cool way to do it. They take a x-ray of the head, a CT of the head, and they load that patient's head, the x-ray, into the machine, so as they use the instruments, it actually guides you into that part of the patient's head, so they get an exact picture of what they're operating on. It's really interesting.
This is just a picture that I was going to share of some of the complex equipment. This is an orthopedic bed that we use for positions for particular cases in surgery, just kind of to give you an idea of some of the complex equipment that we have. And this is just an example of the operating room. This is a room that's ready to go. That you see up there at the top of the picture, you'll see that's where the anesthesiologist sits. And the anesthesiologist is the physician, of course, that does anesthesia for your surgical procedure, whether it's a regional, spinal, or general anesthesia. But that's where they sit, is at the head of the bed, and they stay with the patient the entire procedure. The other equipment there surrounding that anesthesiologist is used for the patient during surgery if needed. That's just an up-close picture showing where the anesthesiologist sits with that blue cart there being the medication cart, and the cart there on the left, anesthesia machine with all the monitors and the ventilator and necessary equipment to carefully monitor the patient during anesthesia. This is a picture of their technology in the operating room with a multiplexer video where we can look at all of the operating rooms. It's a camera mounted in each room, and we can pick a particular room, and it'll show the large shot of that room and see who's in the room if we're looking for a physician or a staff person. We can kind of see from the image on the screen where they are in the particular procedure, so we can let another physician know the timing, if they're going to be late or starting on time, or where they are in the procedure as far as some of their other needs that we can foresee as well. So this is wonderful technology.
Yeah, it really is.
That has just come about in the last 2 or 3 years for us, that has really enhanced their efficiency in operations at Lynchburg General.
The same at the Baptist, and I think it really helps the flow of the schedule, being being in charge, looking at the room, seeing where everybody is and where they are in their procedure. It really does help a lot.
Oh, I'm sure it would.
Our operating room is set up much like a racetrack. Make your lap around that whole entire operating room to check on a room. It takes you away from the desk. It takes you time to also make that trip to the room, where this is a quick snapshot and you can obviously see the whole picture. And there's an up-close picture, how you can just concentrate on one room, and you can see there in a procedure right there.
Thank you. Those pictures are fascinating, and that for people who are not aware of the technology that is in our town, we have access to technology that you would find or expect to find in some of the bigger cities. So I constantly am applauding Centra Health for bringing these innovative things in Lynchburg and to both hospitals.
There is no doubt that Centra usually always provides us with the most up-to-date equipment that we can get, and it really assists us in better patient care, and it really makes the flow a lot easier, and they've always been really up to date. And you're right, we have something at the Baptist called New Boom. It's a technology much like at Lynchburg General, the smart rooms. We're the second hospital in the country to have New Boom, and that was pretty interesting. I thought that we were ahead of a lot of university centers to have the New Boom urology room in Lynchburg. So
I think it's great, and I think it's good for the public to be aware that this is out there, and access to this kind of technology when you need a procedure in the operating room. Do you have specific teams, like at Baptist? Do you have a gynecological team, an orthopedic team at Lynchburg General, a heart team? I know we have people who are well versed in all the procedures, but who specifically work on it.
We do have to pretty much know how to do most everything. You have a general knowledge when you're brought into the operating room. You're trained on how to do cases in general, and you get a good baseline, and then you gravitate, I think, to a niche. Like for me, it was general surgery. Right. And we do have people do what they do, but they can be pulled out into the general population of the operating room. They function extremely well anywhere else. But someone like myself to go in and try to run some of that eye equipment, or know the particulars that surgeon likes for such a delicate procedure, would be much more difficult.